The Center for Disease Control and Prevention reports that nearly 1 in every 5 deaths are caused by cigarette smoking. Yet, despite this fact, 45 million people still smoke today. Smoking is a harmful habit that needs to be kicked, and us friends and family members need to help the smokers quit. I've had personal experience with smoking. My grandmother got lung cancer due to smoking and passed away. I also have an older brother who is a current smoker, and he's tried to quit several times, but he can't because of the addicting habit. I hope that through this speech you all will realize how harmful smoking is and be better equipped with ways that you can help a smoker quit. I'm going to start off by telling you all the harmful medical effects of smoking, then explain why it is so difficult for people to quit, and finish with what you all can do to help them quit. So let's begin. There are several harmful side effects of smoking. The first being that they have an increased risk of coronary heart disease compared to a non-smoker by 2 to 4 times. Cigarette smoking causes reduced circulation by narrowing the blood vessels, the arteries, and puts smokers at risk of developing an obstruction of the large arteries in the arms and legs that can cause a range of problems from pain to as serious as tissue loss. Also, it can cause swelling or weakening of the main artery of the body, the aorta, where it runs through the abdomen. Smokers also have an increased risk of dying from chronic obstructive lung diseases such as emphysema or chronic bronchitis, 12 to 13 times compared to a non-smoker. The smoking damages the airways and alveoli of the lungs. So here you can see what a smoker's lung can look like compared to a non-smoker's lung. Also, smokers have an increased risk of lung cancer. Men have it 23 times compared to a non-smoker, and women have an increased chance of 13 times for lung cancer, which is how my grandmother passed away. So why do people smoke then if they know these harmful consequences can come of it? The American Cancer Society in 2013 says that addiction is marked by the repeated compulsion, seeking, or use of a substance despite its harmful side effects and unwanted consequences. Nicotine creates pleasant feelings that make the smoker want to smoke more. The nicotine acts on brain chemistry and chemistry in the central nervous system, affecting the smoker's mood. It also floods the brain reward circuits with dopamine, which is the same thing that drugs such as heroin and cocaine will do. It also gives the smoker a little bit of an adrenaline rush that they don't really know it's really happening. It will raise their blood pressure and increase their heart rate just a little bit. So the nicotine reaches the brain within seconds after taking a puff, and its effects will start to wear off within minutes. This is why the smoker constantly feels like they need to be smoking a cigarette because the effects don't last very long, which is why people say that a chronic smoker smokes like chimneys. 70% of smokers say they want to quit each year, and about half try, but only 4 to 7% succeed without anyone's help. This is why smokers need our help as friends and family. So what can we do? If nobody smoked, 1 of every 3 cancer deaths in the United States would not happen. So we, as their friends and family, need to encourage them to quit and inform them of the harmful consequences. Some things to do to help them quit. Help them get what they need. Experts say that hard candy to suck on or shards to chew on is good for the smoker because they're so used to having something in their mouth that this will take the urge off instead of actually having a cigarette. Also, spend time with their sweater to keep their mind off smoking. So they can go on a walk or take them to the movies whenever they get the urge to smoke to get their mind off the smoking. Do try and see it from the smoker's point of view. They've been doing this probably for several years now, so they can't quit overnight. So try and be easy on them. So don't judge them, nag, preach, tease, or scold. This will only make the smoker feel worse about him or herself. So hopefully during this speech, y'all have learned a little bit why you should not smoke. So I have made these pledge cards that I hope you all will sign saying that you will never smoke. So let's review. Smoking is a harmful habit that needs to be kicked, and us, friends and family members, need to help the smoker quit. I told you all why smoking is harmful and why people keep smoking while knowing its health consequences, but I've also left you with ways that can help someone quit. I hope that you all are now better informed about the harmful consequences of smoking and what you can do to help. The Center of Disease Control and Prevention reports that more deaths are caused each year by tobacco use than by HIV, illegal drug use, alcohol use, motor vehicle injuries, suicides, and murders combined. This is why smoking needs to be stopped.